What are the major initiatives that International Federation of Red Cross has been taken so far in Palestine and Gaza?
The lack of food has become a priority, the lack of water, the lack of basic services. We were supporting through the Palestinian Red Crescent the health services, food services, shelter.
How do you see China's wisdom and its commitment to the global community?
The vision of building a community where health is for all is a very ambitious goal and very inspiring. China on the domestic side has played, just domestically, has done major milestones advancing health.
On the Boao Forum for Asia Global Health Forum, I have joined by Petra Khoury. She is the Director of the Health and Care Department, International Federation of Red Cross and Red Crescent Societies. Thank you very much, Petra Khoury, for joining me.
Thank you for having me.
So during the Boao Forum for Asia Global Health Forum, you are going to attend the session Strengthening Global Health Governance to Collectively Push Universal Health Coverage. So what will you going to address in this session?
Well, universal health coverage is such an important goal that governments and member states have committed to achieve it by 2030. And as Red Crescent societies, we're committed to support national health plans. There are 4 major things that we hope to push, and I'll share in that session. The first one is about the integration between universal health coverage and emergency preparedness and response. We know that disasters, they disrupt health systems and increase gaps. That's why it is important that the primary healthcare centers that are established have emergency preparedness plans and have the ability to respond when there are emergencies. The second one is creating an equity-centered mechanism. The monitoring mechanisms of universal health coverage monitor overall the whole progress. But we feel that there are segments of the communities that are vulnerable, like women, children, disabilities, that the system needs to take into consideration. The third one is about the global financing architecture. We need to rebalance it. And I think in these days, with all of the budget cuts that are happening on the humanitarian side, it is important to look at all of the financing mechanisms that have vertical targets. We have created funds for malaria, funds for TB, funds for HIV. These are all vertical targets. It's important now to do more of an integration and a horizontal approach to ensure that there is a universality in coverage. The last one is related really to us as Red Cross Red Crescent Network. The network has 5,600 healthcare facilities globally. And we have reached last year more than 100 million people in fragile conflict setting with health services. So our target is to scale up our work to ensure that there is access to healthcare and there is ability to support universal health coverage.
So as a director of the International Health and Care Department of International Red Cross and Red Crescent Societies, what are the key issues globally that International Federation of Red Cross is focusing on?
Our main framework that was adopted by the network overall focuses on health system strengthening. And under it, we have 2 major pillars. One is about health security. The second one is about universal health coverage. Under the health security, we focus on epidemics and pandemics. And it is preparedness, readiness, and response, the full cycle, not just one aspect of it. The second one is responding to emergencies and outbreaks, health emergencies and outbreaks, which is core to when there is a disaster, everybody sees a Red Cross or a Red Crescent flag. So outbreak responses is important for us and to ensure that we are strong on it. The third one is related to the workforce. We have 17 million volunteers globally, and this is the bulk of our workforce. So we would like to develop further our workforce to become more into providing health services and providing health support. That's on the security side. On the universal health coverage, we have priority on immunization. zero-dose kids or children that have not received any dose of vaccines are priority for us, launching immunization programs to target them. Climate health. At the moment, we're all witnessing the impact of climate change on our health, and the movement overall and the network has taken climate change and climate health as a priority for itself.
So, China has been deeply involved in the global health governance, continuously contributing for Chinese wisdom and strength to building global community of health for all. How do you see China's wisdom and its commitment to the global community? What are some major cooperation between China and International Federation of Red Cross in this field?
There's no doubt that the China government has been playing in the last years a major role on the global health stage. And as you mentioned, the vision of building a community where health is for all is a very ambitious goal and very inspiring. China on the domestic side has played, just domestically, has done major milestones advancing health. The universal health coverage in China is at 80% at the moment, with 95% of its people having access to basic health insurance. In 2000, China became polio-free. 2021, malaria-free. So China has achieved a lot of milestones. In addition to the domestic, on the international stage, China has, through the China International Development Agency, (CITCA), they have increased their multilateral partnership with IFRC. Last year, we signed a memorandum of understanding, and since then, we have expanded our health work together. We launched a health program in MENA, in the Middle East and North Africa, and on Africa, we're partnered on eliminating malaria. We're now working in Gambia to eliminate malaria by using Chinese medicine and procuring Chinese medicine to support people in Gambia. So we're very hopeful that China in the coming years will scale up more and more its contribution to the global health.
So in Gaza, there is a worst humanitarian crisis, and we saw that there is a severe health crisis. So what are the major initiatives that International Federation of Red Cross has been taken so far in Palestine and Gaza?
The Palestinian Red Crescent is the local member of the International Federation Red Cross, which is playing a major role in Gaza. They have hospitals and clinics, and as well as they run the emergency medical system and the ambulance system. Unfortunately, it's a terrible and catastrophic situation currently in Gaza, with the siege that has been ongoing for more than 100 days. The lack of food has become a priority, the lack of water, the lack of basic services. We were supporting through the Palestinian Red Crescent the health services, food services, shelter. Unfortunately, in the last few months, I would say, things have become very desperate. We had an immunization program running for children under 5. And the most recent message I received from the teams on the ground, they have not eaten for at least 2 or 3 days because lack of food. And they continue to immunize kids. However, they don't have food anymore, and the kids, they don't have food. It's a very desperate situation, and I hope it's a wake-up call for all of us to look at what's happening there and support to bring resources in. Thank you.